So it's been 15 minutes now, and this is the mobility in the front of the pelvis now. I can now take up the slack and I can spring it, and there's a forward bounce and a recoil. On your stomach, please. If I palpate her PSIS and the sacrum, you'll notice now my right thumb is deeper. Now my left thumb will just slightly overlap the right thumb. So the sacrum is no longer prominent. Okay? And I'll add a statement that the movement studies on the SI did not evaluate anterior and posterior glide motion of the sacrum and of the ilia. They did not evaluate that movement, and especially did not evaluate that in response to a trauma. And you had 3 falls under your buttocks?
Yes.
All right. Sacrotuberous ligament, I can now indent that. Okay? It's no longer rock hard. I can take up the slack and glide superiorly. The force translates through the SI into the rest of your body. And I can translate inferiorly. It goes through the SI into the hip and down. I see your heel bob up and down. Okay? And then I can now spring L5. Let's have you lie on your back, please. Now, we didn't do anything directly to your neck, but it reflexively released. And now with my thumb on your mastoid, I can induce left rotation. I can do it on the right. I can go underneath the mastoid and very easily induce side bending. I'm on the lateral tip of the transverse process of the atlas, and I can glide you to the left, and I can glide you to the right. I can come underneath the spinous process, and I can lift up at C1 very freely. I can lift your head up very freely. I can traction your head in neutral. I see your feet move all the way down, and the contact is here. This is where you need to put the heel of your hand in order to isolate the upper cervical joints. And then when I put your head in flexion, you still have good mobility. Can you show the heels bobbing up and down? Okay, and now with your head in extension, you have good upper cervical mobility. So that was a reflex phenomenon, and you had lots of new chiropractic treatment to the atlas, but it did not restore atlas mobility because that was reflexively driven by the pelvis. Good. So can you tell us how you feel now when you walk and move?
I feel like my right side is letting go in the front, which is where I was so stiff and tight. I feel like this is just releasing. And
that was your main complaint?
A big complaint, yeah.
Okay. And while I was pushing on the sacrum, at the 2-minute mark, you felt what?
I asked you, do you feel it moving? Because I felt motion in the front. That could have been muscles letting go, whatever. But
sure.
What you were doing in the back was definitely like influencing
Something was changing. Yeah. Something was changing. Yeah. All right? So thank you very much. Very interesting presentation. I thought it was fascinating that your scapulae leveled out when we mobilized the pubic joint. Anyway, interesting demonstration of how a rigid pelvis can be changed and how that causes a reflex stiffness in the upper cervical spine that is reflexively driven, and that releases in response to treatment. Also interesting to show the reflex treatment to increase stability of your left ankle. So interesting case. Thank you for letting us film this and post it.
Thank you.